Potato.
Rob Mattacchione, good friend. I got to talk to Rob off the air today. He's the CEO and board chairman of Novo Integrated. They are stock symbol NVOS. Great guy. He's first talked to us about the need for decentralized healthcare, meaning that you don't have to go to the doctor. You know, and the more you think about that, remember during COVID, I'm not going to the doctor.
Oh, yeah.
No way.
Like, I was so afraid my parents who were elderly were going to have to go to the hospital. Like,
Totally.
I'm not going to the doctor. That decentralized thing is when we met him, and that's what happened.
Right. I just remember pulling into a parking lot at Scripps, and someone comes out in a hazmat suit.
Yes.
Right.
And they're
Oh,
looking
come
at
on
you.
in.
Yeah, and then they're
Yeah.
kind of, you know, they do the
Yes.
temperature and the
Fever.
spot, and then
Yeah.
it's like, okay, now you can go in. It's like,
I'm not going anywhere. I'm sitting. Can I drive in?
yeah.
Right? Rob, how are you, sir? Great to talk to you. I know lots of stuff's happening with you guys there at Novo. Is decentralized healthcare further along than it was when we were talking at COVID? Because it seems to me every one of my doctors has an app. I can do a teleconference on my cell phone with my doctors. Okay. I think the only time I had to go to a doctor recently was for a checkup on my knee replacements. Orthopedic guy couldn't really do it over the phone. But this is here to stay, and with what you guys are manufacturing, how far along are we on the process? Are we 10 years away from this being full adoptability? Are you guys right at the right time? Talk to us about that.
I think we took huge strides during COVID, obviously. I think we've taken a half a stride back as everyone tries to feel comfortable in what was normal before. But, you know, the important thing that we have to learn from COVID is that there is an acceptance now of technology and a different kind of technology. You know, we normally deal with diagnostic technologies, labs and x-rays and CAT scans and those types of things. But now we're adopting more of the consumer-based technologies, and that's what really, you know, virtual healthcare is all about, right?
Do you know what it feels like? Do you remember the what I call the Great Correction? It was the mortgage-based crisis, 2009. Dow Jones went down to 4,000, and suddenly we were being more mindful about borrowing money and, you know, making sure that everything's okay. Then let me take you back to another time. What about 9/11? Remember the 2 weeks after 9/11, and we were like, we had flags in our windows, and we were following our right-of-way rules, and we were so polite to everybody.
Yep.
And then, so what did we learn? Well, we're a-holes now, like we used to be post 9/11. 2008 mortgage crisis. We're starting to do liar loans again.
Yep.
And post-COVID, do you remember during COVID, Rob, because you and I talked about this, you'd see a movie. We were stuck at home. I watched a movie, and it was a baseball game. Nobody had masks on. It was weird. Now, when it seems the same thing. Have we not learned anything? Because when you say you took a step back, it's because, you know, until the next cootie comes, I guess we're just going to, you know, go back to how we were. I mean, I remember telling we had to break up the groups, right? Right. My first group was Nickelback that I wanted to break up.
Yep.
But Rob, talk to me about the slide back because the preventive healthcare message needs to get out. That's what's gonna help us all in terms of what's the next thing going to come out of a cooler in Wuhan.
Yeah, and you're right, Sully. I mean, it's great analogies that you pulled up there because we just never learn, right? We're victims of our past, and if we could take advantage of understanding what we did wrong before and just keep moving forward with what was right, we'd be fine. But we don't. And in our case, in healthcare, you know, we've taken a step back. Number one, from our consumership side, us as patients and how we act, but regulators, you know, we need to advance forward. We need to make it easier for doctors and virtual health, for it to work, we need reciprocity, right? We need doctors in other countries to be able to service our patients in the US and Canada and just country to country. And this is that intervention of regulators and colleges and all these, you know, technical people that think they know best and what's right. Best for the profession itself. Right. And that's really what I'm referring to, because, you know, we know now, like you said, you use it every day when you can, and then when you don't, you go in and you see your doctor. Right. But, you know, we have to make it easier for doctors to do their jobs.
Hey, Mary, so you have one of the best BS detectors, mainly because you've been working with me for so many years. Yeah. It's developed. But you're also a great mom. You're discerning. You are a trust but verify person. I know you as a friend. You're not necessarily a cynic. But you were the voice of reason here when COVID was going on, right?
Definitely.
How likely are you to do a televisit now because of that? And then do you trust it?
Oh, I definitely trust it. And I was hoping today, I just was messaging with a doctor before this. He wanted to see my daughter in 2 months. And I thought, can you just see me over the phone to make this easier? Because it's not something that he needs to see in person.
You think the adoption, Rob, is more difficult for the consumer or the patient versus the doctors? because I mean they can get the same dough in less time by doing a I mean, and I realize that there's some liability there. I mean, with our technology these days, I mean, remember when Mike had the herpetic lesion? He was taking the picture and letting all of us see what was on his cheek.
Oh my God, which one?
You know, like the point is, they got pretty good video these days. I know there's some liability issues. There's some things you can't treat over the phone.
Right.
But if I got strep throat, you know I got strep throat.
Totally.
Or like it's ridiculous, which is some of the stuff you're making. So is the adoption harder to get the patients to buy into it, or harder to get the doctors to buy into it, in your opinion?
I think it's a combination of both, to be honest with you, and it depends where in the country you're talking about. You know, rural communities as opposed to metropolises. What's the effect of adoption there, and who's more impacted by adoption? But I think in general, you know, doctors just have a much more difficult time doing things differently, right?
Yeah.
They're taught in a very, very traditional sense, and deviating from that norm is tough, right? And so we have to give them the tools to feel comfortable with it. You're right. There is certain.
That is so true. I mean, every one of my doctors or dentists has a fax machine still. I'm not kidding. Hey, can you fax me over your insurance form? Greg, you have small children. It's less invasive talking to the doctor over the thing, right?
100%.
Yeah.
Yeah. I always thought actually one of the hurdles was the insurance companies saying, no, we're not going to help pay
because
for
of
that
liability?
Yeah.
Yeah.
You have to go in and see. Rob, is that an issue? Do you have issue?
Yeah, you know,
or at least in the beginning, were there hurdles thrown up by the insurance
for
companies?
sure. You know, the liability aspect is always a reality, right? We're a litigious society, and that's a problem. I think some of the insurance companies are worried about abuse with the tool of
makes sense.
healthcare, of the virtual healthcare side. And so that's important. So we have to look at ourselves in the mirror and have a bit of an ethical realization of how to do things properly and feel comfortable with doing it right? Because it's for the benefit of all. But yeah, you know, that's a very good point. Who pays for healthcare?
And what
to address, right?
And what really is the risk of doing telehealth versus Rob? Thank you so much. We'll see you next week. Rob Mattacchione, CEO board chair, Novo. No, the biggest problem is Mike's arms are long enough to get the picture.